how would I leave the spot of like relative comfort and now transition into the devil's medicine of morphine? I'd say morphine is probably the scariest, I guess, of morphine or hydromorphone.
Okay.
How would one transition?
So again, all right. The I don't want to say easiest, but the best markers typically whenever you're using narcotics with patients is respiratory rate. Okay. Obviously all your vital signs that you're looking at are going to be important, but the one that I try and get people to put at the top of the list as they guide, any kind of, pain management with, opioids is respiratory rate. So, again, a lot of times, there was also a perception where if with the guys like, well, I've given ketamine, I can no longer transition over to like morphine or Dilaudid. And that's just not true. Okay. But what you need to understand is when I look at the respiratory rate, typically, the number is they're comfortable if they're kind of in that 8 to 12 to 16. They really probably don't need you to redose any type of an opioid at that point. If you have trouble with some of the numbers, 10 to 20 tends to be numbers that you can remember pretty easy. So if the respiratory rate is between 10 and 20, they really may not need anything. And one of the problems, a lot of times is, us as providers, we look at somebody on the battlefield and how bad the injury is. And we look at that and we see ourselves and we're like, oh God, this guy needs something. Cause if that was me, I'd want it. It's like, no. What is he telling me he needs? And I don't mean verbally. I mean, what are his vital signs telling me he needs? Now, as he starts to, if I'm making that transition, I've done my procedure, I've done ketamine, I've used maybe some IV fentanyl. They've had like the 2 milligrams of Versed. What I'm really looking for, and in my mind, I'm saying, okay, I need to save the ketamine and the fentanyl for other things. I want to transfer over into the morphine or Dilaudid zone. Then I'm looking for that respiratory rate. Once it starts to go up to close to 20 per minute, now I'm thinking, okay, I'm going to start to add in my morphine or my Dilaudid. Now, if we kind of remember back, if you get kind of the equivalent dose, and it's not exact, but if you're trying to remember this, 50 micrograms of fentanyl is about the same thing as 5 milligrams of morphine is about the same thing as a 0.5 milligram or 0.5 milligrams of Dilaudid.